I'm Zach Akunju, a clinician at KAWE, the Kenya Association for the Welfare of People with Epilepsy.
Okay, Dr. Zach, welcome for the interview. And we are going to take you through a few questions, at least to help us highlight what is epilepsy.
Well, epilepsy is a brain condition where there is a tendency of recurrent of seizures which are unprovoked by either neurological or systemic insult.
How does one help someone who is having a seizure?
Well, if you come across someone having a seizure, what you'll do is remain calm and make sure that the area they are having the seizure is safe. They are not in any dangerous place, and you can caution their head if they are falling down, and let the seizure continue until it stops on its own. Don't try to push them down or prevent the seizure from happening. Don't even put anything in their mouth, as most people do. It's not recommendable. And let the seizure stop and wait for them to recover. Stay with them and orient them on what has happened. And you may note the time when the seizure has stopped and how long it has taken.
There is this long saying, they bite their tongue. How are you going to stop it then?
Well, by the time you attempt to put anything in their mouth, they have already bitten themselves. And sometimes what they use to prevent the biting might end up hurting their own teeth or even get bitten by someone having a seizure. So the best thing is just leave them be, let the seizure continue. And the swallowing of tongue, it's a myth that have been widespread, and that's not true. One cannot swallow their tongue while having a seizure.
How is epilepsy identified and how is it treated?
Well, epilepsy is identified while one is having repeated seizures that are unprovoked by any systemic or neurological insults. Well, epilepsy is treatable by reducing the number of seizures or preventing the number of seizures that one is having by a prescribed medicine that has to be taken daily, and some other management that are out there, like surgical and nerve stimulations.
What causes one to be an epileptic patient?
Well, the causes themselves, they say that 70% of the cases of epilepsy, the cause is idiopathic or the cause is unknown. 30% they are linked to brain assaults, most of them occurring during birth. That is the prolonged labor and difficult labors, fast labors, and head injuries or alcohol abuse and drug abuse.
Is epilepsy uncommon?
Epilepsy is common because they say in our country that over 1 million people have epilepsy. Yeah, I don't think 1 million people suffering from one condition, whether it will be uncommon. It is very common.
If it is that common, can people die from epilepsy?
Yeah, there are certain cases where one will have a seizure in a very dangerous place, and there is a case of epilepsy called SUDEP, that is the sudden unexpected death in epilepsy.
What really triggers these seizures?
Well, seizures are triggered by identifiable triggers which vary from one individual to the other. But the most common triggers are the stressful moments, which are either extreme emotions, either you are very happy or very angry, can trigger a seizure. We have hormonal changes either during menses, and environmental factors such as either very cold or very hot, and yeah.
Are the seizures themselves painful or dangerous?
Well, seizures are not that painful. The only thing that will be post-ictal, most of the time people will complain of muscle ache and the headaches, And seizures are only dangerous when they happen when you are alone in a very unsafe place where you may end up injuring yourself.
Are there different types of epilepsy?
Well, there are different types of seizures, and epilepsy types, we have epilepsy syndromes, which are a cluster of features which occur which are classified as a syndrome. But in epilepsy types, we only have different kind of seizures. There are different types of seizures occurring depending on the part of the brain that is affected. We have those seizures that originate from a local point in the brain. Those are called the focal seizures. And we have those that involve the whole brain. Those are called general seizures.
What's the difference between epilepsy and seizures?
Well, epilepsy is the tendency of the seizures occurring themselves. The symptoms, and they are occurring in the sense that they are not provoked by anything, they are occurring spontaneously. And a seizure itself is that transient or temporary physical manifestation of the excitation of that part of the brain, which might be caused by anything else, such as low blood sugars, high blood pressure. Yeah.
So you mean a seizure is just a sign?
Yeah, seizure is a sign. It's a physical manifestation, not necessarily of epilepsy.
What are the best methods in alerting the public of epilepsy?
There are so many methods. One, I see a caravan being one of the best, because to move from one town to another, alerting people. We can also have local radio stations talking about epilepsy, and people listening and asking questions through the vernacular radio stations. We can have flyers either on the roads, in the matatus, all talking about epilepsy. We can have sponsored leaflets being distributed like in the street. We have display of messages about epilepsy in umbrellas, in vendors' umbrellas, all those kind of. They could help us in raising awareness on epilepsy, or people talking about epilepsy.
Does epileptic patients have developmental disabilities and or psychological difficulties?
Well, developmental disabilities may coexist with epilepsy, and for psychological issues, they happen mostly in severe and uncontrolled epilepsy.
What's your advice to the family, friends, and the general public concerning the encouraging epileptic patients, especially children and adults, to live a life with no struggle?
For those with people with epilepsy, they could play part in their management by reminding them of the drugs, to take them daily, to be able to identify triggers that trigger their seizures and help them as much as possible to avoid them. They should also let them interact with other people, carry on with their activities, and only avoid those dangerous activities like driving or maybe moving in height or being in a very high place that would endanger their lives.
Okay, on behalf of the public, I want to tell you a big thank you for letting us understand exactly what epilepsy is and how we are going to help our sisters, our brothers, our children who are suffering from the same condition. So I hope everyone in the public has understood what and how they should help whoever is suffering from the same condition. Your interviewer has been Mando Ungerenathan, and I say have a nice moment.